Today I will be reviewing the movie Prozac Nation. This was reviewed by Julia Hanna, and my colleague Olivia Rooney. Elizabeth Wurtzel is a 19-year-old freshman at Harvard University, and she has struggled with depression from an early age. Her family life consists of an absent dad and an overbearing mother. She was always an outsider in high school, but in college she began to experiment with drugs and boys. This new lifestyle leads her to fall back into her clinical depression. This movie is based off of the novel Prazac Nation and takes place in the mid-1980s. This movie begins in a time where people with depression were not taken as seriously as they are taken today. They were almost dismissed and overlooked. People who experienced depression were just sent to a therapist and had to depend on themselves to get better. They would have to force themselves to live even when they may not have had the urge to live. However, after Lizzie goes through many years of therapy and trying to cope without medication, she is eventually prescribed an antidepressant, Prozac, which helps her want to live. The disorder presented in this movie is known as atypical depression. This is a subtype of depression, and it is commonly known as a disorder that has severe negative moods and/or feelings and a lack of interest in things that you used to enjoy. Having this disorder affects how you feel, think, and behave, and can lead to troubles in day-to-day activities. Most individuals who experience this may feel as if living isn't worth it. The film's cultural context impacts Lizzie's diagnosis by starting her treatment slowly, almost as if it was dismissed. She first started with therapy, and then the depression kept only getting worse, and causing her to have issues in her day-to-day interactions. Once it was noticed that it was getting worse, it called for more attention, so an antidepressant was prescribed. In this time, antidepressants weren't always looked at for the first use of help. In different cultures, the disorder known as depression is looked at in a different way than in the United States. It's not always diagnosed, such as in developing countries, a disorder such as depression wouldn't be their top concern. Other countries also may have a different way of looking at it and treating it rather than we would in the US. Many risk factors that are similar across cultures is gender, unemployment, and common loss. Some stigmas that are associated with depression include people thinking, oh, they can choose to be happy or sad, or people think that they only have depression for attention, or that if they laugh or smile out in public, they couldn't possibly have depression. Some examples of the symptoms displayed in this movie are insomnia. An example of this would be around 24 minutes into the movie, Lizzie is faced with issues dealing with her father. Soon after this, she begins writing an article for her editor. Once she begins the article, she stays up all night for 4 consecutive days writing an article, and this was just the beginning of her sleep difficulty. Another example is suicidal thoughts or attempts. In the first scene of the movie, Lizzie is seen at a young age sitting home alone in the locker room and begins cutting herself with a razor on her leg. Also, about 7 minutes remaining in the movie, when Lizzie gets overwhelmed with her therapist, she is seen trying to cut herself in the bathroom with a broken cup. Another symptom shown but has little evidence is guilt. Lizzie shows the signs with her mother but does not show this sign whenever she is with her best friend. Proposed treatment plans for depression could include antidepressants. Antidepressants are drugs used for the treatment of major depressive disorders. The ethical concerns of antidepressants are that people can become addicted to them and that they are often overprescribed. Another option could be electrocompulsive therapy. This is a procedure done under general anesthesia in which small electric currents are passed through the brain, triggering a brief seizure. This seems to cause changes in brain chemistry which can quickly reverse symptoms of certain mental health conditions. Ethical concerns include heart problems, nausea, possible hallucinations, and shakiness. Therapy is another option, which includes speaking and feeling completely open with a therapist about your problems. The barriers that Lizzie faces in this movie for treatment is that she is not cooperative, she has excessive drug use, and antidepressants weren't commonly prescribed. This film accurately displays depression. Lizzie is able to cover up her depression whenever she is out with friends, but whenever she is alone or with someone she cares about, she breaks down and we can see her symptoms getting worse. This film shows that depression can be very gradual and then it can hit you all at once at some points.